I'm from RMIT University, and we have a dental specific area within the School and Life of Physical Sciences. So I'm here on behalf of that team of professionals. I've been asked to talk particularly about the career pathways for the qualified dental assistant. I am aware in Australia that dental assistants can work in practice, whether that's private or public sector, without a qualification at all. But things are changing in the industry, and there is a move now to look at training to upskill and formalise qualification in the dental assisting sector, of which I'm part of that group. I'm going to be talking also about why I do encourage further training, and I know that Dental Health Services Victoria are particularly focusing on improving training opportunities now for the dental assisting cohort across Victoria, and I'm been working in partnership with Julie McCormack to provide specialised training for that group of people within your sector. I'm going to also have a big focus today on oral health promotion, given that today is a conference focusing on public oral health, and my particular background and passion in fact is oral health. And RMIT has been providing oral health training now for 5 years, of which I've implemented with a huge push from government policy into our sector. I'm also going to be talking about skill sets, what does that mean, and where that is going in training, not just in dentistry but across the community health area as well, and how that relates back to oral health promotion. And there are skill sets now for dental assistants in radiography, and RMIT has been training radiography skill sets for the dental assistant at the Certificate 4 level now for 8 years. And in July I'll be taking the 9th cohort in this group. So I'm really excited to see that there is some progression in career for the dental assistant now in Australia. So to put it in a bit of a snapshot, to progress in training, you first of all need to have a nationally recognised qualification, and that's Certificate 3 in dental assisting. Now, more than 30 years ago, I trained as a dental nurse at the Royal Dental Hospital of Melbourne, and those years, it was a 2-year full-time program, so I worked for 2 years, and whilst working at the hospital, I was rotated, like all other students, for 2 years through hospital departments, training on the job, as well as studying and obviously taking exams and qualifying as a dental nurse. Years go by and the term dental nurse became redundant, and the dental nurse became the dental assistant across Australia and also particularly across the world. So there is no such thing now as a dental nurse in training circles. From the year 2002, the Commonwealth of Australia government set up what's called a health training package, and this is a nationally recognised, accredited framework for training in a lot of allied health, including dental assisting and dental technology and dental prosthetics. This training is national, which means that RMIT, in providing this training, is the same training across the world, across Australia, and is now being taken into the international forums as well. And RMIT has been part of training in Singapore at the dental hospital there for a 5-year program, which I was part of too. So I've had some exciting opportunities. Now, from 2002, the health training package published the opportunity for training in 4 streams, upgrading from Certificate 3 to a Certificate 4 level, and the student, the undergraduate, would step into one of these areas and be trained in 7 units, 4 of which, or 3 of which are common to all, and in RMIT training we have a 4th unit that's our elective but is common to all 4. On top of that, you would do 3 units devoted to the stream of choice. So dental radiography has 3 units dedicated to training in intraoral and extraoral radiography. So in Victoria, that's required to have that training to obtain a licence to undertake intraoral and extraoral radiography on patients. Oral health promotion is 3 units as well, and I'll be talking more about that particular job role in a moment, so I'll leave it till then. Last year, in 2012, RMIT started the Dental Practice Administration Unit with Dental Health Services, and we've also had a student who did the general anaesthesia program as well with us here in the hospital. So we've been promoting and providing training in these areas for some years now. So you might ask yourself, if you're a dental assistant or you're perhaps a manager of a group of people, you know, why would I be promoting training for my particular personnel or for myself personally? So I just put a few ideas there to try and encourage training. I certainly do promote it. I think it's fantastic. I see huge professionalism coming out of the group of dental assistants now, and they are a professional in their own right, and they are part of the dental team. And to provide quality service to your patients, you need quality training behind your dental assistants. Dental assistants are your backbone to your practice, whether it's private sector or public sector, and you need to consider training and keeping those dental assistants current in current, things like infection control, for instance, which changes over the years. So you're enhancing your job role by going back to training. Training occurs while you're working, so it's relevant to your particular area. It also promotes leadership opportunities and enhances communication and analytical skills required in any workplace. And of course that increases job satisfaction, particularly in the role of the dental assistant. Now, training is government-led and is being underpinned by policy, and I'll just point out a couple of policies that are relevant to the dental assistant and why training in Certificate 4 is relevant now, because of the focus of the policy of healthy mouths, healthy lives particularly, which was published in 2004. Where they were saying things like team dentistry, team approach, more effective use of the existing workforce. So there's been a change to looking at the dental team as a whole and how that can improve productivity, time efficiencies and cost effectiveness in promoting and providing dental treatments and oral health promotion activities. And Sue Kearney was good enough to introduce us today to government policy in detail, following on from Deb Cole this morning. And I just wanted to put myself in that group of strategies that are being promoted at the moment, where the dental assistant could have a huge role in team approach to improving the oral health status of our community. So I wanted to talk about the oral health promotion skill set. This skill set is dedicated to the dental assistant in promoting an increase or enhancement to their job role in a clinical setting, or perhaps in more public community setting, like promoting, as we saw a colleague earlier today talking about promoting oral health at the local area of a preschool environment. The dental assistant now can be trained, and highly trained I have to say, to that level of job role. So it's complementing current professionals. It's not changing other professionals' job roles, but complementing and going out with someone who's had 18 months of training in oral health promotion, led by myself as a therapist and also a dental hygienist. The two of us have been leading this training now for, as I said, 5 years, and with some fantastic success. It's all about preventing oral diseases, and the dental assistant can be trained to a level where they are supporting and complementing what the dental practitioner is actually trying to focus. So repeating messages from someone who's well trained to do so is going to benefit your particular focus in your oral health plans. Team focus, so it's promoting the dental team. It's not just one person now selling a story to the client or patient or family or group of people. It's a team of people saying the same things. It's promoting the community engagement of oral health, and I think that this is an exciting era for the dental assistant to step up and become part of that oral health promoting team approach. So having those skills, you contribute to improving patients' access to oral health care. You are supplementing already what's out there already, so enhancing in some ways. Reinforcing, as I said, health messages can be of benefit when you're trying to change someone's behaviours, particularly on oral health, in trying to encourage someone to improve their smoking cessation. If you're hearing the messages many times over in different ways, one-on-one, time effectively, you may be able to make a change to the individual, or more globally in health promotion messages in community settings. It's also about collaborating with other health professionals, and some of the projects that our students have been engaged with are very much focused on the allied health professional, the maternal health nurse, the person who works alongside the resident in the supported residential services like we saw earlier today. People that are in aged residential environments, the dental assistant can go out there and promote oral health messages to the workers and the carers and the families of these clients. And our projects are actually promoting this at the moment. Over the last 5 years, we have been doing projects in all these areas, including high schools, preschools, primary schools, mothers groups, groups that are associated with diabetes, sports clubs, and the list goes on. We've also had a dental assistant student go out with their dentist to a prison and promote health messages within that cohort of incarcerated people in our community. So it's really exciting from my point of view. The dental practitioner is focused heavily, I think, at the moment on treatment, and why not have the dental assistant trained heavily focused with the health messages that you want to portray to your client groups. So I'll just have a list there of the sorts of settings that our dental assistants are going out to. We've got a number of community health dental assistants at the moment going through our program, or have graduated already, and they have gone out to various groups, including Indigenous and non-English speaking groups like the refugee groups in our community. So it's very exciting, and I implore you to consider supporting the dental assistant in training to get to this level of opportunity to promote oral health messages for our community. I just wanted to quickly go through the scope of practice of this professional, just to put it into a nutshell so you have an idea, because the feedback I'm receiving is that people are really not sure what sorts of skills this person would have once graduated. So the first focus is chairside education. So this might free the practitioner up to do treatment focus. You might start off by providing this sort of information, but then the family or the child or the client would come back and see the dental assistant one-on-one. And I know that in a couple of settings across Victoria at the moment this is occurring already, where the families are seeing the dental assistant after treatment planning by the practitioner. So it's an exciting move, and it's supported by certain community health groups. By one-on-one interviewing too, you are motivating the client to think about their diet, for instance, or other behaviours that have an impact on their oral health. So this is the sort of thing that listing that our graduates are coming out of our program fully trained. So they are fully trained in saliva testing, which would be part of a risk assessment that you would be considering perhaps for your clients. Certainly they have a lot of information and knowledge about oral disease, particularly the dental caries and periodontal diseases, and sorts of things that could prevent those diseases in clients of various ages and backgrounds. They're trained to do diet analysis and counselling, plaque disclosing using Tureski scoring as well, so they're trained to do that. They're trained to promote particular products that the practitioner is suggesting. So if the practitioner suggests to a client that tooth mousse would be ideal as part of their home care, the dental assistant can then provide the information to that client one-on-one, away from the dental practitioner who's doing another, perhaps seeing another client, and discuss how to use tooth mousse and when to use it, etc., etc. Things like toothbrushing technique and interdental cleaning is certainly a focus, smoking cessation, and also mouth rinses and the sorts of products to look at when you go to a supermarket. We also train them in the care of different prosthetic appliances, including ortho appliances. We also train the student in using checklists as part of a risk assessment analysis for the practitioner and planning for that person, and also as part of prevention, it's about sport injuries, and some of our dental students are going out promoting that to sporting clubs at the moment. So we train them to also do presentation work, so they're actually highly trained in providing presentations of all types, PowerPoint versus the more intimate presentations to all sorts of diverse groups in our community. So that's oral health promotion, you know, a bit of a nutshell, because I've only got 20 minutes. And I think I've only got 5 minutes to go or something, because we're running out of time. But I just wanted to also say that some of the dental students are keen to progress even further than Certificate 4, and would like to have those opportunities, and having an enter score of 90 something to get into Bachelor of Oral Health, for instance, is outside their realm. So RMIT has taken a huge step. And from this year, 2013, I'm proud to announce that we have commenced the first ever cohort in Victoria of the Advanced Diploma of Oral Health, which is the dental hygiene stream. So to get there, you need to have Certificate 3 first, and then Certificate 4 in dental assisting with the radiography skill set for the licence to take the intro and extra-oral radiography. And then from there you go through a selection process to be considered for 24 places only in each year. So just a little bit of a snapshot first though on what radiography means. There is a skill set now in the health training package that people can do. It's 3 units and under prescription of a dental practitioner, and it's under prescription only. So a dental assistant cannot take a radiograph without that prescribed radiograph in writing on a treatment plan. They do not get trained either to diagnose from radiographs at all. So that's not as part of their training whatsoever. So I wanted to make that quite clear that we only train them to produce the image, manage the patient, and get it to a point where it's diagnostic for the practitioner to use. This is a time-efficient, patient-centred approach to support the dental practitioner in the clinical setting. So the dental assistant is trained at the same level of taking a radiograph as a dental practitioner is. And just to finish off, a little bit about the Diploma of Oral Health. This commenced this year, as I said, and it's a 2-year full-time study load. So we're taking each year 24 students only. We are only the second state in Australia to deliver this program. So there's only 2 programs, one here at RMIT and the other is in South Australia. Our program has been accredited by the Australian Dental Council in October of last year, of which I was part of, and the person that's a graduate of this program is registered as a dental hygienist. So it's not a Bachelor of Oral Health. The skill set of this person is solely devoted to the dental hygienist skill set only. This person could be and is already from South Australian training, working in the private and public sector environments of Australia.